Hi everyone, this is Dr. Corey Kenyon, Clinic Director of Rivergate Chiropractic. Today I'm going to talk to you about nutrient deficiencies. It's epidemic at this point. Now some people ask, can I just take a multivitamin to take care of it? And unfortunately, no, because the amount of nutrients in a multivitamin typically is just not enough to correct deficiencies that are already there. They're more to prevent severe deficiencies from happening over time. For example, let's say your vitamin D levels come back and it's a 17. And it should be between 60 and 80. And you're taking a multivitamin that has 400 units of vitamin D. It's just not going to get the job done. At that level on that blood test, it would take 5,000 to 10,000 units daily just to make a change. So we test for 34 different nutrients. We check for all your fat-soluble vitamins, which are A, D, E, and K. And we look at all the B vitamins, the amino acids, and the essential fatty acids. It's very common to be vitamin D deficient because what destroys B vitamins? Stress, and in some people even gluten. Now we'll talk about gluten shortly, but right now with the stress issues, what stress does is it destroys the B vitamins and it actually causes you to use them up faster, so you become vitamin deficient, and that can lead to many conditions that you may not even realize are due to the deficiencies. So let me show you a quick example. We've got the test results back on this guy, and you'll be seeing, you may not be able to see this, it might not be clear for you, but we're looking at our B vitamins, our vitamin C, our vitamin D. We've got our amino acids, our essential fatty acids, and we even looked at our testosterone and cortisol levels, which are the stress hormone. Now this particular individual is low on B1, B2, B5, and then B12. And when we look at his vitamin D, he's sitting at a 25.5. Now like I mentioned earlier, I like that to be between 60 and 80. Now vitamin D, it's a very common deficiency, but the big deal with the vitamin D is it protects our heart, it helps keep the immune system in balance, and it even affects your ability to make your hormones. So you can see why this is something you do not want to be deficient in, what with the top two killers in our society being heart disease and cancer. We want to protect our heart and we want to keep our immune system balanced. Now with his amino acids, he's low in a couple of them, L-alanine and L-glutamine, which you'll see with this type of a problem, you're not going to heal or you're not going to bounce back like you used to. So if you're somebody who likes to work out, you can't bounce back after the workout. You have to start taking more time off between workouts because if you try to push through and work out on your normal schedule, you may find that you start to get sick more often. With these amino acids being low, you're also going to see that strange little things, little cuts and bruises, they take a lot longer to heal than they did in the past. Now the essential fatty acids, he was low in the omega-3s and omega-6. Again, this is going to affect the healing ability. So we checked the 34 different nutrients and we looked at your testosterone and cortisol in this particular case. Now, earlier I mentioned what destroys your B vitamins instead of stress, but also that gluten can be involved. Right now they're finding 40% of the U.S. is gluten intolerant or sensitive to the gluten. So what happens when you consume gluten, which is the protein that is in wheat, it's what helps hold it all together. It's the glue. But what it does in us, it damages the villi, which are little finger-like projections that stick into the inside of the tubes of our small intestines. The problem is these villi, that is where we absorb the nutrients. So if we damage these little villi, we cannot absorb the nutrients, and over time we become nutrient deficient. And these nutrient deficiencies, they can lead to over 200 different conditions. And they can all be linked back to gluten. Everything from migraines to infertility, unexplained skin rashes, even all the autoimmune conditions, of which there are 140 different types. So basically the gluten wrecked your small intestine, it led to the nutrient deficiency, and now you have all these other different issues. Does that make sense? So rather than saying, okay, here's a B-complex vitamin with a small amount of all the B vitamins, let's determine, do you have a B1, a B2, a B5 deficiency? And let's give you extra of those so that we can build that back up and get you balanced out. Make sense? So, the nutrient deficiencies. We can test those in office. It's a quick test. It only takes a few minutes to perform, but it gives us a lot of valuable information. Now, we can determine what you need to take from that point on. Okay? It's not guesswork. We're not going to guess at things. We're going to test. We're going to fill in the gaps where we need to, and we're going to work to help achieve more optimal state of health and wellness for you. So thank you for watching. If you have any questions, give the office a call at 615-859-6677. And again, thank you for watching and have a great day.